Thank you for joining me for the spine pre-op class. I'm May Tebby, and I am the Spine and Ortho Coordinator at Melbourne Regional Medical Center. I will be your liaison between yourself, the physician, and the hospital. I'll be overseeing your entire patient experience, starting with pre-op preparation, which we're doing today, discharge planning. We'll make sure that the office has set up your follow-up appointment, home health care needs are addressed, you have your DME, like your braces, your cervical braces, your LSO braces. Also, when you're at the hospital, I'll be rounding in on you daily just to see how you're doing and see if you have any questions or concerns. I also work very closely with the staff to make sure that they're educated on best practice for our spine patients, and I work very closely with the surgeons to identify areas of improvement and developing standards of care. Also, once you're discharged from the hospital, someone from our team will give you a call and just see how you're doing at home as well. Make sure you have everything you need, and again, answer any questions or concerns. Objectives for today are understanding your procedure, knowing what to expect during your hospital stay. We'll talk about pain management, taking care of yourself at home, the role of the caregiver. We'll talk about discharge planning, physical and occupational therapy, as well as the spine program that we have here at Melbourne Regional. We'll go over the anatomy real briefly. So the spine is composed of 24 individual vertebrae. There's 7 cervical, 12 thoracic, 5 lumbar, and you count from the top down, and the 9 fused vertebrae form your coccyx and your sacrum. In between each vertebrae is a disc, which primarily serves as a shock absorber, and each vertebrae contains a central hole in which the spinal canal and the nerves are contained and protected. These are some examples of disc problems that you can have anywhere along your spine. So the top example is just your normal spine, and you can see the next is the degenerated disc, then the bulging disc, the herniated disc, thinning disc, and the last one is the disc degeneration, and then you can see the little osteophyte formations or those bone fragments. Surgical options are fusion, and that's where you connect 2 or more of your vertebrae, eliminating the motion in between them. Or you can have a laminectomy where you remove part of the bone from the posterior or the back part of your spine. There's disc replacements where you actually remove the worn disc with a prosthetic device. And then there's also implantable devices that help with pain, so such as your spine cord stimulator or your intrathecal pump. So these are all options to help with any spine issues that you may have. And these are just some more examples with some actual pictures of the procedure. So we are the first Joint Commission certified spine program in Brevard County. We are very proud of that. Some types of surgeries that we do are the ACDF, OLIFs, kyphoplasties, laminectomies. We do have cutting edge technology, so we use Maser robotics, O-arm, the C-arm, which uses minimally invasive techniques. We have our surgeons, Dr. Cronin, Dr. Data, Dr. Hines, Dr. Malloy, and Dr. Pop. Like I said, we are the first spine certified program in Brevard, first certified in June of 2021. Why Joint Commission certification? Well, we do feel that it improves the quality of care provided to our patients. It demonstrates we have a commitment to a higher standard of service. We are held accountable. Not only can we say we do things, but we have to prove that we're doing them as well. It enhances staff recruitment and development, and it is internationally recognized as a gold seal of approval. Our spine program mission and values correlates with the Melbourne Regional Medical Center mission and values. So our spine program is committed to providing the highest quality care with compassion and respect while instituting the core care values of the Steward healthcare system. So that's compassion, accountability, respect, excellence, and stewardship. We do use a collaborative approach. That's all of us working together. That's surgeon, the nurses, physical therapy, occupational therapy, case management. We all work together to work for best patient outcomes and best patient satisfaction. The personalized care begins in the surgeon's office. So some examples are the guidebook that is provided by your surgeon's office. If you do not receive that in the office, you can pick up a copy at the security desk at the front of the hospital. But make sure you are familiar with all the information inside the guidebook, as there's a lot of really good information in there. Look at your pre-op exercises. So there's exercises you can do to strengthen yourself prior to surgery that will really help in your recovery after surgery. And with that said, I know everyone's at different abilities of what you can do prior to surgery, so do your best with that. Also look at the circulation exercises. So there's your ankle pumps, your quad presses, your butt squeezes. Make sure that you're familiar with those. You can do those while you're sitting or laying down, and it's extremely to start those as soon after surgery as possible. This promotes circulation, which helps in healing and also helps to prevent blood clots. Preparing for surgery, again, we just talked about everything in the guidebook, so just make sure you're familiar with everything in there. You should also know which home health care agency you're using. That's usually set up by your surgeon's office. So if you have any questions about that, make sure you ask your surgeon's office. Make sure you stop any over-the-counter vitamins or anti-inflammatories, so that's your multivitamin, your fish oil, your vitamin E, anything over the counter really. So any Celebrex, meloxicam, any herbal medications, fish oil, all of those medications I just mentioned do have some blood thinning components in them that can interfere with all the medications you're getting the day of surgery that may also have some blood thinning components in them. If you are in the care of a pain management doctor, make sure you talk with them about who is going to be managing your pain after surgery. Post-op scripts will be called in a few days prior to surgery, so you can go ahead and pick them up probably 2 to 3 days prior to surgery. Once you pick them up, make sure you leave them at home. You do not need to bring that into the hospital. We do have medications to provide for you here, but we do want to make sure you have those at home. Also, you'll need to get your MRSA screening prior to surgery. This can be done at our hospital. I ask that you just make sure that your surgeon's office has sent an order into the hospital prior to coming here. Pre-op labs need to be done prior as well. They may order a type and screen, and if a type and screen is ordered, this will need to be done within 3 days of surgery. Also, you will need to have your durable medical equipment or your DME. So if you're having an ACDF neck surgery, you will have to have your Aspen collar and maybe a soft collar. If you're having lower back surgery, you may have to have your LSO brace. Also, some surgeons may order a walker or a 3-in-1 commode. Not everybody needs one, but just in certain circumstances. So if you feel that you would benefit from one, make sure you talk to your surgeon's office. Also, you will need to have a coach. That's a family member or friend that can stay with you for at least the first couple of days. You will also need a medical clearance from your primary care provider. They may give you instructions to stop or change any medications. They may order additional lab work, EKG or a urine test. If you have heart issues, they may order a cardiology consult. If you have breathing issues, a pulmonology consult. And this is all just for your safety, to make sure that you're safe to go under anesthesia and you're safe to have this surgery. If you're having a surgery with an abdominal incision, usually called an ALIF or an OLIF, the surgeon may order a bowel prep. So that's 2 days prior to surgery. You may have to start a magnesium citrate. It usually starts at 2 p.m. After that, you'll be on a clear liquid until after surgery. Also, there'll still be nothing to eat or drink after midnight. The other thing of importance if you're having an abdominal incision is that after surgery, you'll probably be started on a clear liquid diet first. So that's very important. We want to make sure that you get your bowel sounds back or you're passing gas before we advance you to a regular diet. Chlorhexidine gluconate shower. So this is the soap that we want you to wash with prior to surgery. And this is because your skin isn't sterile, so we want it to be as clean as possible. What I would recommend you do is wash for a total of 3 times. The first time will be 2 days prior to surgery, the day before surgery, and the morning of. What I recommend you to do is go ahead and wash with your regular shampoo and your regular soap first. Go ahead and rinse that off, and then use 1/3 of the bottle from your neck below, not in your face, not in your hair, not in your privates. It is very drying and very irritating, so we do not want to get it on anywhere that's sensitive. Leave the soap on for 2 to 3 minutes and then rinse that off. After you take your first shower, make sure you change your sheets so you have a nice, fresh, clean set of sheets and fresh pajamas to sleep in. And if you do have any pets, we ask that you do not have any pets sleep with you from now until after surgery, because pets tend to leave dander, and so we just want to make sure you're as clean as possible, like I had mentioned before. Also, there's no shaving your legs or your armpits for about 48 hours prior to surgery, and no shaving facial hair for 24 hours prior to surgery. And this is because we don't want to take the risk that you're going to get any cuts or any abrasions and allow any microorganisms into your skin. Preparing your home. So think about where you're going to be sitting after surgery. So chairs with armrests are good because they help you get up and down. Recliner chairs are good because you can put up the bottom part of the recliner. You can do your circulation exercises. You can sleep. If you have any throw rugs or any extension cords, go ahead and remove those. Those can become a tripping hazard, so we don't want to have any falls. I do recommend a nightlight in your bedroom, so when you're getting up in the middle of the night to use the bathroom, you can see clearly where you're going and what you're doing. Things that you use often, so your favorite coffee mug, your favorite toothbrush, make sure you put that on somewhere that's easily accessible on counter height, so you're not having to reach up or bend down every time you're going to use it. Also, if you have any pets, I do recommend someone taking care of your pets or having somewhere to put them while you're recovering. Small pets can become a tripping hazard. Larger ones can jump on you and maybe knock you over. Also, if you have any animals like dogs that need leash walking, make sure you're not doing the leash walking. Make sure your coaches or a friend can be doing that for you. Pre-admission testing. So this nurse will call you 3 to 4 days prior to surgery. They're going to go over your health history and your medication history. It is a pretty lengthy call, and depending on the amount of medications you're on or your health history, it can last anywhere from 30 to 45 minutes. Again, you are going to need a coach. This is very important. Someone to stay with you for at least the first couple of days. It could be a family member or a friend, someone to provide comfort, motivation, and support. What I want you to bring to the hospital are loose-fitting clothing. So loose shirts, loose t-shirts. Bring your brace. Remember, if you have the cervical brace, you'll need your Aspen collar. If you have back surgery, you'll need your LSO. If you have sleep apnea, make sure that you bring your CPAP machine. Leave your valuables, your cash, and your medications at home. The only exception to this will be if you use an inhaler, like for asthma, or if you use any specialty eye drops, like for glaucoma, go ahead and bring those in. A lot of our patients also like to bring in their cell phone and have that with them, and that's fine because this way you can be in touch with your family and your friends. Flip-flops, please. So make sure you wear supportive shoes that have a back and a front and a non-skid bottom. And again, this is to prevent falls. Surgery schedule time, they will call you the day before surgery between the times of 2 to as late as 7 p.m. And the reason is we wait for the whole day of surgery to be done. We wait for the next day to be set in stone, and then we go ahead and make the call, because the surgeons can actually change the surgery time up to the very last minute. So we don't want to confuse things and have to change, with changes in time. So we just wait until we know that it's set in stone. They're going to go over a morning review and reminder. Again, there's nothing to eat or drink after midnight. The only exception to this is if the pre-op nurse that called you 3 to 4 days prior to surgery goes over your medication history and sees certain medications that you can take the morning of surgery. And if there are, you're just going to take those with small sips of water. They'll also remind you to bring your advance directives in so we can make a copy and put it in the chart. The day of surgery, you're going to check in with the security guard, let them know you're here for surgery. They'll show you where to wait until they call you back to get registered. Then you'll wait in the waiting area until the nurse comes to get you to prepare you for surgery. When they are preparing you for surgery, your coaches can't go back in that area at that time. But once they're finished preparing you, the nurse will go out, your caregiver can come and stay with you until they actually roll you back to surgery. And again, remember to bring your brace the morning of surgery. Once you're back getting prepared, the nurse is going to get the phone number of the caregiver or the person you want the surgeon to call after surgery. They're going to change you into a gown. They're going to give you some packets of antibacterial cloths. One packet will be for your left arm, one will be for your right. They'll give you instructions on what to do. There's an antimicrobial mouthwash that you'll go ahead and brush your teeth with. There's a little sponge, you'll sponge around your cheeks, and then you're going to gargle and spit out the rest. There's also an antimicrobial ointment that's swabbed around the outside of your nose. And this is called our nose to toes program, and it is all to prevent surgical site infections. The nurse will also at this time insert 1 to 2 IVs, and this is for your anesthesia, your medications, your IV antibiotics, everything that you need for surgery. We will also teach you how to use the incentive spirometer. So anyone who's ever had surgery before, I know you're familiar with a device like this. So this is because after surgery, we're laying, we're sitting, we really just aren't moving like we normally are, and we are not expanding those lungs. So what can happen is you can get a post-operative pneumonia, so low-grade fever, coughs. So this device just reminds us that we need to take nice deep breaths, and it gives us a really nice visual of how we're doing. And you'll take a nice deep breath in through this tube, which will get the yellow disc to rise up along with the ball. We'll go ahead and document what you're able to do prior to surgery. That's going to be your baseline, and that's what we're going to aim for after surgery as well. And this is very important because if you're not able to get up to your baseline after surgery, that will alert the nurse that maybe, we need to check into that, maybe have a respiratory therapy consult or something like that. We do recommend you use the incentive spirometer 10 times an hour while you're awake. I wouldn't do them all 10 times at once, but say you're watching TV with commercials, every time the commercials come on, do 3 or 4. And I would do it up to probably the first week after surgery. And once you're done using it, make sure you toss it out, because with the saliva, there can be bacteria on there. So we definitely don't want to keep them. So toss it out after you're done using it. The nurses are also going to put on TED hose. So these are also called anti-embolism stockings, and they go on both of your lower extremities. And these are nice and tight on purpose to promote circulation to prevent blood clots from occurring. We ask that you wear this up to a week after surgery. You can take them off at night and when you shower. The nurses are also going to put on the SCDs, or sequential compression devices, and these wrap around your lower extremity on top of those TED hose, but these hook into a machine at the end of the bed that runs on electricity, and it just gently inflates or deflates, Again, the same premises as the TED hose to promote circulation to prevent blood clots, but these are only for hospital use, so you do not need to wear these when you go home. You will also meet your anesthesia team here in the pre-op area. They're going to go over your health and medication history. They're going to discuss any nausea or pain medication concerns you may have. So if you know you get nauseous after anesthesia, definitely the kind of thing you want to let them know. If you've had any reaction from anesthesia before, definitely the thing you want to let them know. The surgeon is also going to see you here in this area, and he's going to put his initials on the area that he's doing surgery. So if you do have any last minute questions or concerns, this is a good time to ask your surgeon. Next, you'll go to the operating room, and we do have a website that's on this slide that you can click on, and you can see our new surgical suites. There's also some videos that go over the different procedures. So if you're having an ACDF or an OLIF, pain pump, those will all be short video clips on there. So take a look, go ahead and click on that site and take a look at what we have. After the OR, you'll be going to the recovery room or the PACU. You'll be there for about 1 to 2 hours. They stabilize your vital signs, do neuromuscular checks. If you're in pain, they'll give you something for pain. Nauseous, they'll be giving you something for nausea. Also, this is where you're going to get your cold packs. So all of you will be getting an ice sleeve, and you get to take these home. Each sleeve has 2 compartments in it, and each compartment fits 1 ice pack. So there'll be 2 ice packs per sleeve. All of you will get 4 ice packs to take home. So your job is to make sure you get your sleeve and your 4 ice packs before you get discharged from the hospital. And once you get home, make sure you put the 2 that you're not using into the freezer so they're ready to go when you need to change them out. After PACU, one of 2 things are going to happen. You're either going to go to our phase 2 or our extended recovery and go home same day, or you'll be coming up to our orthopedic unit, which we do have all private rooms. And we do have staff that's specialized for our orthopedic patients. Depending on what status you're in, if you don't know what status you're in, like if you're going home same day or if you're coming upstairs, make sure you ask your surgeon's office. They should be able to tell you that prior to surgery. There are certain criteria, very strict criteria, that you have to meet before going home same day. So your vital signs have to be stable, dressing dry and intact, no active nausea or vomiting, pain well managed. You have to be cleared by physical therapy, so they have to watch you walk and make sure that you're safe to go home, and you have to urinate. If for some reason you don't meet that criteria within the time frame that's expected, usually about 3 to 4 hours after surgery, then we'll bring you up under observation just to keep you overnight. After PACU, it doesn't matter if you're inpatient or going home same day, we do monitor you very closely. So we'll have your blood pressure cuff on your arm, measuring your blood pressure and your pulse. You'll have pulse oximetry monitor on your finger, measuring your oxygenation levels. You'll have a couple liters of oxygen going to your nose via nasal cannula. You'll have IV fluids going to your IV. Remember, you're going to have those white TED hose on, those anti-embolism stockings, and the SCDs on top of that, inflating and deflating. You'll have your ice packs on. You also may have a Foley or a drain. A Foley is a tube that's inserted into your bladder to collect the urine. Most of them will, if you do have one, most of those will be removed the next morning. Also, you may have a drain, which is a smaller tube inserted near your incision area to collect the excess accumulation of fluid, and those can stay in for 1 to 2 days. Also, the nurses will do a head-to-toe assessment, and we'll be asking you quite often what your pain level is. So on a scale of 0 to 10, 0 being no pain, 10 being the worst pain you've ever had, we ask that you set an acceptable pain goal. We do understand that everybody's pain tolerance is a little bit different, but we ask that when you set your pain goal, it will be one that you can eat, you can sleep, you can be pretty comfortable. Remember, getting to a 0 is going to be difficult, especially after surgery. But the reason we ask you to set an acceptable pain goal is because if you set it at 4, anything that goes above a 4, so definitely a 5, 6, or a 7 or above, and you're due for something for pain, you're going to take something for pain. There are no gold stars for holding out on pain medication after surgery. And the reason is because if you do hold out on pain medication, the next thing you know, you're going to be up at a 9 or a 10. And at a 9 or a 10, surgical patients don't want to move because every time they move, that's when they get the pain, the surgical incision pain. So they don't want to move. And that's the opposite of what we are promoting. We want you up and walking with physical therapy as soon as possible. I want you doing your circulations while you're laying or you're in bed or you're in a chair. So that's going to be very important. Also, once you're up at a 9 or a 10, it takes a really long time to get back down to your acceptable pain level. And I just do not want that for you. So make sure you intercept the pain, ask for medication when the pain starts to escalate, don't wait. Take your medication on a regular basis if you need to. So most of the time, pain medication is written every 3 to 4 hours. So at the end of that time frame, go ahead and rate your pain. If it's a 1, 2, or a 3, you can say, you know, I don't need to take anything right now. I'll wait another 30 minutes or hour and then reevaluate. If at that time, though, it's a 7 or an 8 or higher, you're definitely going to take something for pain. So that's how I would stay on top of that. If the medication isn't working, make sure you let the nurse know because we can always add something in there or we can switch the pain medications around. And always ask questions. Make sure you understand the pain management efforts that are in place. So always be your best advocate, not only in just for pain management, but really in all aspects of your care. You should be involved and know what the plan is. Post-op activity on surgery day, we talked about the circulation exercises. So the ankle pumps, the quad presses, butt squeezes. Remember, you'll have your SCD machine plugged in, inflating and deflating. You'll be using your incentive spirometer, 10 nice deep breaths an hour, and also physical therapy will be working with you as well. Remember, physical therapy has to see you before you can go home. If you're going home same day, if you come up to our orthopedic unit and you're up to the floor by, I would say, 5 or 6 o'clock, you'll be seen and evaluated same day as well. If you're one of the later surgeries, you may not be seen until the next morning, and that's okay. Our staff is able to make sure, if you want to, that you're able to get up safely and walk to the bathroom and that you can at least stand and pivot in a chair if you're ready to as well. Spine precautions, very important. There's no BLT, so that's no bending, lifting, or twisting. Also, when you are up walking around or ambulating or in a car, you'll have to wear your Aspen collar. If you've had neck surgery or if you've had back surgery, then most of you will have to wear an LSO brace. So this is just an example of what the cervical collar looks like, the soft surgical collar. So this is mostly like if you're sitting for comfort reasons, sometimes you just feel better having that on. There's also, these are your Aspen collars or your hard collars. And again, these need to be worn while you are ambulating, walking, or in a car. And these are the types of braces for your back surgery, so your lower back, so your LSO and your TLSO. Again, this is when you're ambulating, walking, or in a car. Preventing post-op complications, obviously a huge concern for all of us. So we can look back at these types of surgeries and see what complications occur the most frequently, and then we can look to see what ways prevent these from occurring. And that's what we have done. So to prevent blood clots and pulmonary embolus. So a pulmonary embolus is a blood clot that has been released from your lower extremities and gotten stuck in your lungs. We do a lot to prevent this. So again, we have those TED hose that we want you to wear for at least 1 week after surgery. We have you doing the circulation exercises as soon after surgery as possible, so that your ankle pumps, your quad presses, your butt squeezes. Also, we want you up and walking with physical therapy as soon as possible. Once you're home, I do want you to get up every 1.5 hours to 2 hours to walk around. You don't have to walk a marathon, but even if you walk to the bathroom and back or to the kitchen and back, I just don't want you laying for long periods of time while you're awake. For pneumonia, we do a lot to prevent this, so we give you the incentives barometer. Remember, 10 nice deep breaths an hour. There's also some coughing and deep breathing exercises in the guidebook that you can be familiar with. And again, getting up and ambulating, walking, that really helps to prevent pneumonia as well. Nausea and vomiting can occur. Remember, our bodies aren't used to getting anesthesia or all the medication, the pain medication, the antibiotics, so we can get nauseous. So just make sure you let the nurse know we do have medications that we can give you, and even a prescription we can send you home with if that occurs. Infection, and we monitor your vital signs frequently. Remember, before you come in to the hospital, we give you that HIPAA soap that we want you to wash with a total of 3 times. Also, when you're here in our pre-op area, we give you that nose to toes that prevents surgical site infections. Also, you will all get at least 1 to 2 doses of IV antibiotics. Your first dose will be in surgery. The other thing that's very important is hand washing. So everybody coming in your room should be washing their hands, if not with the traditional soap and water, definitely with the hand sanitizers that are located all throughout the hospital. And again, if you've noticed someone hasn't done that, you can be your best advocate and ask them to do so. Another complication that can occur and is pretty common is constipation. So constipation does occur frequently with people who are taking pain medication. So I would recommend you go ahead and get your over-counter stool softeners, so your Colace, your Miralax, your Senecot, and after surgery, go ahead and start those. Don't wait for issues with constipation to arise. Just go ahead and start taking them to prevent that from occurring. All of you will be what we call a falls precaution. So you will have a yellow wristband on and yellow socks on that identify you as a falls risk. And this is because you just had surgery. So a couple of things, you're not really used to walking yet, with your braces. Also, a lot of times after surgery, you feel pretty good when you're laying down or you're sitting, but when you get up, especially that first couple of times, you may get lightheaded or dizzy. So we just want to make sure that we are within arm's reach. If that does happen, we can prevent any incidents. So make sure you call for the nurse before you get out of bed. Hand washing, again, I already said every person in and out of the room should be cleaning their hands. Make sure, and if you can be your best advocate and make sure that if they haven't done that you can ask them to do so. Discharge instructions, you guys will all have a set of clear discharge instructions based on the type of surgery you had. Also, it will be clear when your follow-up appointment is, the home health agency along with the phone number, medications you're sent home with, and instructions on what to do in case you have any questions or concerns. Once you are home, remember, I want you to change positions often. So every 1.5 to 2 hours, like I mentioned, I want you up and walking. Like I said, you don't have to walk a marathon, just, if you're up and walking in the room, that's good. I just don't want you sitting for long lengths of time. Follow your precautions strictly. Remember, no BLTs. That's no bending, lifting, or twisting. When you're up walking or in a car, you should be wearing your Aspen collar or your LSO brace. Walk daily and steadily and increase your distance as you can. And if you can limit your stair use, go ahead and do so. Pick 1 day a week to measure your progress. Do your exercises regularly. So just as important as surgery goes is what you do after surgery with monitoring your precautions and also doing your physical therapy up and walking. Make sure you eat healthy. So sometimes after surgery, you may not be too hungry. So make sure that the choices that you do choose are nutritious. Your body does need the right nutrients in order to heal. And no smoking. So nicotine increases your risk for infection and it decreases circulation, which decreases healing. And it really does inhibit fusion from occurring for the fusions if you've had a fusion spine surgery. So very important to not smoke. If you need to ask for a nicotine patch, please ask the nurses for one while you're here. Take pain medication regularly, exactly as prescribed. speak to your surgeon about when to discontinue or stop your medications, take your stool softeners like we had just talked about, and resume your pre-op medications as instructed. Also, here's my phone number and also my email. So if you have any questions or concerns, please either call me or send me an email. And thank you again for choosing Melbourne Regional Medical Center to have your surgery, and we will see you soon.